Hello and welcome. Thank you for joining today's webinar, Improving Patient Engagement in Cervical Cancer Prevention. My name is Helenka Ostrom. I am a public health analyst with the Health Resources and Services Administration, also known as HRSA. I support communications for the Division of Women's Health within the Maternal and Child Health Bureau. Please introduce yourselves in the chat with your name and organization. This webinar will be recorded and posted on HRSA's YouTube channel. A link to the recording will also be emailed to everyone that registered for this webinar. We also have a Q&A box where you can direct any questions at any point during this presentation. Today's webinar is held in observance of Cervical Cancer Awareness Month, which occurs every January. You will learn about HRSA's participation in the Federal Cervical Cancer Collaborative and the FCCC's resources. The newest FCCC resource is a patient engagement toolkit that supports efforts to increase patient and community engagement in cervical cancer prevention, screening, and management. The toolkit was designed to meet the needs of health centers and safety net settings. It may be useful to other healthcare organizations that are committed to preventing cervical cancer. I will now turn it over to Shirley Payne, the Director of the Division of State and Community Health and the Acting Director of the Division of Women's Health within HRSA's Maternal and Child Health Bureau.
Thank you so much, Helenka, for that. Again, my name is Shirley Payne. I am with HRSA's Maternal and Child Health Bureau. I am with the Division of State and Community Health as the director. Most folks know us as the Title V MCA Services Block Grant, and then also the acting director for the Division of Women's Health. Next slide. Oh, yep. One more slide for me, please. Thank you. Before we get started with today's speakers, which I'm so excited for you all to hear more and learn more from them today, I want to briefly share a bit about our agency for those of you who may not be familiar with the work that we do. So the Health Resources and Services Administration, or HRSA, is a component of the U.S. Department of Health and Human Services. We support a broad range of programs to provide healthcare to people who are geographically isolated and economically or medically vulnerable. Each year, HRSA's programs support tens of millions of people, including those with low incomes, people with HIV, pregnant people, children, parents, those in rural communities, transplant patients, others with other community needs, and we really try to work hard to support the workforce within those communities to support them, health systems and facilities that care for them. So lots and lots of things, and these are just a few of the highlights there of those that we are able to serve. To tell you a little bit more about what we do here in the Maternal and Child Health Bureau, or you'll hear me refer to it as MCHB. So the Maternal and Child Health Bureau, we really do work to strengthen the public health system to improve the health and well-being of America's mothers, children, and families. Our vision really is envisioning America where all mothers, children, and families thrive to reach their full potential. And this includes children and youth with special health care needs. We reach more than 61 million pregnant people, infants, and children with special health care needs. Next slide, please. I'm excited to tell you more about our MCHB Division of Women's Health. It is a newly formed division for the Bureau. And really a lot of where we focus and our primary focus really is providing the leadership, technical assistance, and support to improve health outcomes from women. And that also includes many of the maternal health investments that we have as well. We work to engage with health professionals and stakeholders to disseminate the latest evidence and best practice when it comes to women's and maternal health, establishing those short and long range goals of what it is that we would like to see, and being able just to improve and be more in that prevention space And as we think about early identification and treatment, referral for health services for women and their families, we want to make sure that that's happening because we do know that with early detection leads to greater outcomes. And so one of the priorities of our division of women's health is cervical cancer prevention. So you will learn more about how we're able to support health centers and safety net settings through our work with the Federal Cervical Cancer Collaborative. So looking forward to the webinar ahead, and I know that you all will enjoy the information that we're going to share today. I'll now turn the presentation back over to Helenka to introduce our next speaker.
Thank you, Shirley. And I did see there was a note that the chat was disabled. That is fixed now. So go ahead and put your name and your organization where you're calling in from into the chat. It is my pleasure to introduce Ellen Hendricks. Ellen is a public health analyst who leads the Federal Cervical Cancer Collaborative from HRSA within the Maternal and Child Health Bureau. In this role, she leads strategic planning, development of technical assistance materials, and oversees the administration of multiple contracts to deliver a remote learning series for healthcare providers using the Project ECHO model. Ellen, I'll turn it over to you.
Thanks so much, Helenka, and thank you all for joining us today. We are really excited to be connecting during Cervical Health Awareness Month, and we're equally excited to share some new resources with you to support your work across the cervical cancer continuum. So the Federal Cervical Cancer Collaborative, or FCCC as we call it, aims to inform and accelerate the uptake and implementation of cervical cancer prevention, screening, and management approaches by HRSA-supported and other safety net settings of care. Next slide. Since 2021, HRSA and our federal partners have co-sponsored the Federal Cervical Cancer Collaborative. It's comprised of key federal partners across the Department of Health and Human Services, and those are listed on the slide, including HRSA, the National Institutes of Health, HHS's Office of the Assistant Secretary for Health, Centers for Medicare and Medicaid Services, and the Centers for Disease Control and Prevention. This collaborative bridges the federal priorities of cancer research and healthcare delivery by HRSA-supported and other safety net settings of care. It also supports the National Cancer Plan. The FCCC has developed a variety of resources, including the Patient Engagement Toolkit and Provider Toolkit that you will hear more about today. All of the FCCC's cervical cancer resources are available on HRSA's website at www.hrsa.gov/office-women's-health/FCCC-resources. And we'll be dropping the link to that in the chat so you can access all of those resources. Next slide. So why are we focusing on cervical cancer? Well, we know it's largely preventable through vaccination and highly treatable when caught early through screening. However, disparities in the prevention and management of cervical cancer persist, including human papillomavirus or HPV vaccination coverage, screening rates, and cervical cancer mortality, particularly for underserved patients. In the United States, every year, about 200,000 people are diagnosed with cervical precancer. Roughly 12,500 people are diagnosed with cervical cancer, and approximately 4,000 will die of this cancer. Next slide. So as I mentioned before, we are focused on safety net settings of care, and you may be wondering what those are. So safety net settings of care are places where people with limited or no insurance or who are low income can receive care. And the FCCC's objectives include describing current practices, challenges, opportunities, and innovations, identifying best practices, and enhancing coordination and partnership to improve cervical cancer care among these settings. Some of the settings include HRSA Health Center program sites and federally qualified health centers, CDC's National Breast and Cervical Cancer Early Detection Program sites, critical access hospitals, rural health clinics, Ryan White HIV/AIDS program providers, and Title X clinics. While this is not an exhaustive list of safety net settings, it provides examples of the kinds of healthcare settings that our resources are focused on. Next slide. So safety net settings play a crucial role in ensuring the nation's highest need communities have equitable access to cervical cancer prevention, screening, and treatment. More than half of all new cervical cancers are diagnosed in women who have never been screened or who have not been screened in the previous 5 years. In 2019, the percentage of women overdue for cervical cancer screening was 23%. For women with public insurance, it was 28%, and for those who were uninsured, it was 42%. Rates of overdue screening varied by race, ethnicity, geography, and other factors. For example, women who identified as lesbian, gay, bisexual, queer, or other were more likely than heterosexual women to be overdue for screening. And the COVID-19 pandemic only worsened these disparities. Next slide. So research also indicates that the most common reason for being overdue for cervical cancer screening was an individual's lack of knowledge that they needed screening. Increasing awareness and addressing patient education are critical to helping prevent cervical cancer. Using the Federal Cervical Cancer Collaborative resources outlined in this presentation, health centers and safety net settings will have the power to make a profound impact on the lives of patients and communities. Next slide. As part of its ongoing work, the FCCC hosted several roundtable series in 2022 and 2023 that included discussions of provider and patient engagement in new guidelines, HPV vaccination and screening, technical assistance, federal coordination, and evidence-based innovations such as self-collection for HPV. This series led to the development of a provider toolkit, the new patient engagement toolkit, and a Project Echo virtual learning collaborative called CERV-Net, which we look forward to sharing with you today. Listed here on the screen are these the focus areas of our roundtable series. So we engaged with providers, healthcare administrators, federal staff who were working in the U.S. Virgin Islands, U.S. affiliated Pacific Islands, Puerto Rico, and also in national associations and in academia. Next slide. So we're pleased to share 2 Federal Cervical Cancer Collaborative toolkits, which we hope you'll find meaningful in your organization's important efforts to prevent and respond to cervical cancer. As I was mentioning in the previous slide, starting in 2022, in response to noted disparities and a shifting cervical cancer landscape, the FCCC launched a cervical cancer moonshot roundtable series. This series convened a broad range of subject matter experts and representatives from safety net settings of care, as I previously mentioned. In our discussions, we looked directly at the challenges, opportunities, and innovations to strengthen the current state of cervical cancer care, and we conducted a similar series in 2023 with a theme of patient engagement. We used the insights shared in these meetings to inform 2 technical assistance products, a toolkit to increase patient engagement, and a toolkit to build provider capacity. We are glad to share both of these tools are now available on HRSA's website in English and Spanish. And as I said, we'll be adding links to the resources in the chat. You can also scan the QR code, which is on this slide, to get access to that webpage and those resources. Next slide. So the first resource that we're going to be covering is the newly released Patient Engagement Toolkit, which is the newest resource from the FCCC. And as I mentioned, this is available in English and Spanish. This was developed to support efforts to increase patient and community engagement in cervical cancer prevention, screening, and management. It provides materials and resources that aim to promote vaccination, screening, and management in safety net settings. The toolkit materials and references are based upon the 2019 American Society for Colposcopy and Cervical Pathology, or ASCCP, risk-based management consensus guidelines. These guidelines were designed to be quickly updated to reflect new evidence provided through the Enduring Guidelines Working Group. Please ensure that the materials you use for your practice adhere to these latest guidelines. Next slide. The Patient Engagement Toolkit is designed to equip and empower staff with tools, materials, and actionable steps to encourage cervical cancer prevention among existing patients and others in the communities who may not be served by your health center yet. We refer to health centers throughout the toolkit, but the content is designed for multiple settings, including those other safety net settings that I had previously discussed. Next slide. The toolkit is divided into 4 sections. There's an introduction, which provides a brief overview to the toolkit. We have 6 new materials. We also have a community partner guide with suggestions on how to work with community partners. And we also have additional resources. Next slide. So the communication patient engagement materials include a social media calendar, a screening by age poster, a live script, text message library, LGBTQIA+ poster, and a cervical screening follow-up card. Next, I'll share more about each of these materials and how you can use them in your practice. Next slide. Within the patient engagement toolkit, you will find the social media calendar. This calendar provides sample written content and graphics to share on Facebook, Instagram, X, and other platforms. These are written to promote cervical cancer prevention during 2 key times during the calendar year: Cervical Health Awareness Month in January, which we're currently in, and back to school in August and September. They can also be used throughout the year to encourage preventive actions. You can view all of the social media copy and graphics in the toolkit. There are 10 unique social media graphics for Cervical Health Awareness Month and 16 social media graphics for back to school. On the slide here, you can see examples of 2 from each of those timeframes. Next slide. You can download the social media JPEGs on the FCCC resources webpage. The social media graphics are available in English and Spanish. When you download the zip files, you will see that each file is also formatted for X, Facebook, and Instagram. For example, in the zip file, there are 3 versions of the image on the right: 1 for X, 1 for Facebook, and 1 for Instagram. The JPEG titles identify the version formats. Next slide. Next is the screening by age poster. This poster outlines recommended cervical cancer screening guidelines by age and across a person's lifespan. It serves as a visual aid to help patients understand the ongoing importance of cervical cancer prevention and screening. You can hang the poster in waiting rooms, offices, or non-traditional settings such as libraries. It can also be printed and shared with individuals inside or outside the healthcare setting. You can view the screening by age poster in the toolkit, and you can also download the standalone PDF version of this poster in English and Spanish on the FCCC resources webpage. Next slide. The patient engagement toolkit also contains 2 live scripts and information about how to use them. A live script is a short message developed for someone to read aloud or to record for later broadcasts in a variety of settings. It can be used in numerous ways as telephone on hold messages, public service announcements or PSAs on local radio stations, or in community settings. The toolkit also explains how to secure a radio station public service announcement. Next slide. Within the patient engagement toolkit is also a text message library, which is a collection of pre-written text messages. Messages can be sent to remind patients of screenings, offer educational tips, and encourage proactive health measures. If you already have a text message system, incorporate these messages into your existing texts. These are meant to supplement existing text messages that may already be used, such as appointment reminders or birthday wishes. If text messaging is not part of your communication with patients, these messages can be used in other places, such as emails or
I think Ellen froze for me. We'll give it Just a
might be a-
minute. I know there's some weather passing through.
Okay, sorry about that. Where did you where did I cut off?
Right at the end of, if the text messages aren't part of your communication with patients, then they could be used in other places.
Okay, thank you so much. Yeah, just to reiterate that if you're not using text messages, they can be used in emails or other newsletters. Next slide. Our next patient engagement material is the LGBTQIA+ poster. Cervical cancer is a concern for anyone with a cervix. This poster is designed to promote cervical cancer screening among lesbian, gay, bisexual, transgender, queer, intersex, and asexual or LGBTQIA+ individuals. It features inclusive language and imagery to ensure that all members of the community feel welcomed and informed. You can view this poster in the toolkit, and we have two versions. Version 1 does not have a QR code, but version 2, which is portrayed here on the slide, has a QR code that connects people to HRSA's Find a Health Center tool. And if you scan that QR code, you're directed to the Find a Health Center tool, which allows you to insert your zip code and find high quality healthcare within your nearby. You can also download the standalone PDF versions of this poster in English and Spanish on the FCCC resources webpage. Next slide. Our next resource is a cervical screening follow-up card. This customizable follow-up information card offers healthcare settings a chance to provide additional information to support and empower patients after screening. It is designed to help health centers build relationship with patients and empower patients with information to increase follow-up care if needed. We suggest printing these cards in advance and sharing with patients after their appointment. They have a blank section that the health center or patient can use to write down additional information, such as health center hours, contact names, or other important information. You can view this screening follow-up card in the toolkit and download the standalone PDF version of this card in English and Spanish on our webpage. Next slide. As I previously mentioned, the toolkit also includes a community partner guide to support health center staff such as administrators, patient navigators, and community health workers in developing partnerships in their community to promote cervical cancer prevention, screening, and treatment. It is intended to facilitate collaboration with community partners such as faith-based organizations, nonprofits, local businesses, and community centers. This step-by-step guide will help you to identify the communities you serve and don't serve to decide whom you want to reach out to, determine the places and settings where people in these communities go, reach out to contacts to start a partnership. It provides resources to partnering businesses and organizations. It'll help you to follow up with partners to confirm participation and express appreciation, and it'll allow you to share your resources and your success with your new partners. Next slide. The Patient Engagement Toolkit's final section contains additional resources to help patients understand HPV infection, cervical cancer screening, and their test results. Review these materials and consider whether you would like to share these with patients or use the content to help your patient engagement efforts. We also recommend reviewing materials to make sure content is up to date and accurate before use. As we know, the cervical cancer landscape is continuously changing. Topics include cancer support services, HPV vaccination toolkits and information, resources for special populations, other patient engagement toolkits and relevant resources, and general patient education materials. Like I've said in the previously, you can visit our Federal Cervical Cancer Collaborative Resources webpage to explore the full toolkit. The Patient Engagement Toolkit is a companion to the toolkit to provide to build provider capacity. And I'll now turn it back over to Helenka, who's going to provide an overview of this provider toolkit.
Thank you, Ellen, for sharing more about the FCCC's work and the new patient engagement toolkit. As Ellen stated, the toolkit to build provider capacity, also called the Provider Toolkit, was the first toolkit developed after the FCCC's Roundtable series with experts in 2022. And as Ellen said, experts included primary care providers, oncologists, patient navigators and advocates, researchers, and members of government. And as a result of those discussions around cervical cancer care, the toolkit to build provider capacity was developed and published in 2023. It is also available in English and in Spanish on HRSA's website. So let's dive in a little bit more into this toolkit. The Provider Toolkit is intended for providers in safety net settings of care. In this toolkit, we use the term providers to refer to anyone involved in cervical cancer prevention, screening, and management, including physicians, nurse practitioners, physician assistants, nurses, medical assistants, administrative staff, community health workers, patient navigators, care coordinators, and others. While some sections may be more relevant to some roles than others, we take a holistic approach to reflect all aspects of the care team. This toolkit was designed with several aims in mind. Overall, we aim to improve quality of care by providing practical tools and resources tailored to safety net settings of care. We design the resources for care teams to train key clinic staff. The toolkit includes resources and scripts to support providers' communication with patients and to foster consistent patient engagement. There are resources and scripts on how to inform patients about HPV vaccination, cervical cancer screening, exam results, and follow-up. It also provides information to support patients' consistent engagement with screening and management guidelines. And it includes content to support evaluation and to identify opportunities for improvement. There are 9 chapters in the toolkit to build provider capacity. Chapters 1 and 2 include background on the current cervical cancer prevention landscape. Chapters 3 to 5 have a clinical focus. They cover HPV vaccination, cervical cancer screening, and management and follow-up. Chapters 6 to 9 are non-clinical and include important organizational aspects of cervical cancer prevention, including innovations in change management, quality improvement, establishing and strengthening partnerships, and patient engagement. Each chapter includes action items, practical guidance and tools, including provider scripts, and links to trusted resources for more information. So now we'll delve a bit into the chapters, starting with HPV vaccination. Chapter 3, the HPV vaccination chapter, includes effective strategies for increasing HPV vaccination rates. The HPV vaccine may prevent more than 90% of HPV attributable cancers for male and female patients. And while several barriers to HPV vaccination exist at the patient, provider, and system levels, this chapter includes scripts for strategies providers can take to mitigate barriers through impactful communication with patients and parents and adopting interventions such as clinical decision prompts and standing orders. Providers can use this content to improve vaccine recommendations, address vaccination concerns, and increase vaccination rates in your practice. Cervical cancer is most often diagnosed in people who have not been screened, who were underscreened, or did not have appropriate follow-up care after abnormal screening results. To address these issues, Chapter 4 includes information on screening guidelines and eligibility, considerations for screening among different types of patients, scripts for discussing screening with patients, and practical suggestions for adopting evidence-based interventions to increase screening rates. Providers can use this content to stay current on screening guidelines, identify and implement interventions to improve screening rates, and incorporate patient-centered discussions into your practice. Next, the management chapter includes practical suggestions for how to determine and understand the right next steps for patients, how to talk with patients about different kinds of tests and interpret the results, and guidance for implementing interventions to ensure patients can access follow-up procedures at the right time. Providers can use this content to stay current on management guidelines, discuss tests and test results, and implement interventions to help ensure patients stay up to date with follow-up exams and procedures. In Chapter 6, we recognize that the evidence base for vaccination screening and management changes over time. So it is important that safety net settings are equipped to prepare for and respond to new innovations, technologies, and updates to guidelines and recommendations. Because change management often requires substantial institutional effort, the Innovations and Change Management chapter covers guidance and tools to support leadership and staff buy-in during practice changes, initiating change management, and assessing an organization's readiness for change. This chapter also looks to the future with information on self-sampling and tips on staying up to date on the future directions for self-sampling. Providers can use this content to help their practice adapt to new innovations and updated guidelines, including addressing resistance to change. Next, since so much of the evolving landscape includes practice changes, we include content to equip safety net settings of care to evaluate new and current interventions and processes. The Quality Improvement chapter helps with meaningful goal setting, the use of data to assess progress and outcomes, tools to conduct quality improvement activities, and strategies for reporting and disseminating related findings. Providers can use this content to set clear goals for practice improvements and learn how to use data to assess progress towards quality improvement goals. Now in Chapter 8, we describe how partnerships may enable safety net settings to increase patient awareness of and access to healthcare and wraparound services, and also how partnerships can improve healthcare delivery through coordination and communication. The partnership chapter includes information on the characteristics of strong partnerships, ideas for potential partners, and how safety net settings can partner with patients and communities for larger scale program improvement, such as co-planning activities that address social needs. Providers can use this content to help your practice strengthen existing partnerships, identify and engage new potential partners, and work with patients and communities to improve patient care. Lastly, Chapter 9 is the final chapter in the Provider Toolkit, and it's about patient engagement. We know that empowered patients are more receptive to using healthcare services, so we include content for providers to improve interactions with patients, to improve clinical outcomes, and empower patients to make informed decisions. This chapter is designed to help providers assess patient needs, discuss cervical cancer concepts, navigate patients who may fall out of care, and conduct outreach to patients and community groups to improve patient health outcomes. Providers can use this content to engage patients and empower them to make informed decisions about their health. That is our overview of the provider toolkit. Next, I'm going to share information about CERV-Net, a cervical cancer echo learning series. This learning series used a training model for health systems that came from the University of New Mexico, called Project Extension for Community Healthcare Outcomes, also known as the acronym Project ECHO. Project ECHO is an evidence-based framework to facilitate remote learning. CERV-Net is a free, virtual, collaborative learning series that prepares and empowers safety net settings of care to engage partners, patients, and communities to improve cervical cancer care across the cancer continuum. In 2024, we hosted 2 cohorts of our learning series with providers from safety net settings. The first cohort consisted of participants from the US, as shown on the map on the left, and the second included providers in the US-affiliated Pacific Islands, or USAPI, are listed on the right. The USAPI providers were from the Commonwealth of the Northern Mariana Islands, the Republic of Palau, Guam, the Federated States of Micronesia, and American Samoa. Each cohort consisted of 11 weekly 1-hour sessions covering cervical cancer prevention, screening, management, and quality improvement activities. 2 to 3 representatives from each organization participated in each session of this learning series to foster active discussion and ongoing engagement. Now, the benefits of CERV-Net were vast, and they included a comprehensive curriculum curated by leading experts in the field that covered patient-centered care and the latest advancements in cervical cancer care. There were interactive workshops to discuss in-depth case studies with experts and other providers to gain insights on successful approaches, common challenges, and innovative solutions. The participants also had networking opportunities to engage with a diverse community of healthcare professionals and build a network of support. They also had access to FCCC resources and tools that were tailored for implementing best practices and enhancing the overall quality of care. They also received continuing medical education credits, or CME credits. For each cohort, cohort 1 and 2, we engaged 3 subject matter experts who facilitated the learning sessions and led didactic presentations. Each session followed a similar agenda that's shown on the screen. It started with introductions, moved into a didactic presentation from the subject matter expert. There was a portion of Q&A, question and answer, and then there was a case study presentation that was led by the participants, and then that followed with a group discussion about that case study. We conducted a process and outcome evaluation of our CERV-Net learning series. Within the process evaluation, participants reported high rates of satisfaction with the administration of each session, the content of the didactic portions of training and case studies, and the training and technical assistance and coaching provided by the subject matter experts. The process evaluation also shed light on the barriers and facilitators to implementation and identified best practices for future replication endeavors. These promising strategies include selecting a diverse group of sites and participants to allow participants to draw from their unique experiences to enhance peer-to-peer learning, employing virtual site visits with participants before the start of the learning series to prepare them for the series by mitigating any potential technical issues and acclimating them to the learning environment, and providing sufficient discussion time by limiting the didactic presentations and prioritizing case study and discussion time. The outcome evaluation data is forthcoming, and we look forward to integrating these findings into our future training opportunities. As some next steps, we are really excited to announce that the FCCC is sponsoring a third cohort of CERV-Net that will occur between April and June of 2025. This cohort will focus on sites in the U.S. Virgin Islands and Puerto Rico, grantees of HRSA's Accelerated Cancer Screening Program, and rural settings. All safety net settings, including the CDC's National Breast and Cervical Cancer Early Detection Program sites, are eligible to apply. We anticipate that we will circulate the call for applications in early 2025. If you're interested in learning more, you can reach out to me, Helenka Ostrom, and here's my email. It's HLEPKOWSKIOSTRUM@HRSA, that's HRSA.gov. You will be added to a list to receive email updates when those applications are open. Today, we shared information about 2 toolkits from the Federal Cervical Cancer Collaborative. You can use the QR code or visit the link on the screen to access the resources. To recap, the Patient Engagement Toolkit supports efforts to increase patient and community engagement in cervical cancer prevention. Materials include a social media calendar, screening by age poster, live read script, text message library, LGBTQIA+ poster, and cervical screening follow-up card. The Patient Engagement Toolkit was designed to be used by staff at health centers and safety net settings of care. This could include office staff, communication coordinators, patient navigators, or other full-time, part-time, or even volunteer staff. The toolkit to build provider capacity is meant for safety net providers to help negotiate challenges in cervical cancer care and adopt new guidelines and approaches. It may be used by providers as well as other staff in safety net settings. The toolkit includes sections on HPV vaccination, screening, quality improvement, innovation and change management, partnerships, and patient engagement. We will now take a few moments to answer questions. Please add any questions to the Q&A box. Also see there's a request to add my email into the chat, so I will add that now. Ellen, the first question I have is for you. What are some future projects for the FCCC?
Thanks so much, Helenka, for that question. So we know that self-sampling for HPV was recently approved by the FDA for use in healthcare settings. And as a collaborative, we're really actively thinking through how we can best support health centers and other safety net settings of care in adopting and implementing this exciting innovation. We'll be amplifying guidelines and communications around self-sampling and exploring ways that we can integrate self-sampling into the workflows of health centers and also into existing federal data sets. And we're also consistently leveraging our federal collaborations to amplify those evidence-based strategies that we know work best for care across the cervical cancer continuum.
Thanks, Ellen. And then how can you support Cervical Health Awareness Month? I can take this one. So all throughout the month of January, we encourage you to go to the FCCC resources webpage, download those social media images that Ellen shared, and there is a folder that is specific to Cervical Health Awareness Month. Some of them can be retooled throughout the year, as Ellen discussed. and you can download those and then share them on your social media platforms. And you can use the different images on some different social media platforms too. So we have them aligned for X, for Instagram, and for Facebook. We also encourage you to start some conversations in your community. You can share the screening by age poster, the LGBTQIA+ posters, and you could ask if they could be put in different locations such as clinics, community sites, or places of worship. And with those live read scripts that you can use, you could go to a radio station and see if they can promote those during the month of January. You could also have some of those on a recording when people call maybe into a practice, that they could hear part of those scripts as part of their communication with the practice, or even putting it on an email or other forms of communication that you have with patients. If it's a banner in a portal that they go to, that would also be a great way to promote it. And I do have a question, will the slides be emailed to participants? So we will be sharing a link to the recording and then the transcript and a link to any of the resources that were shared. And that will be emailed to all participants, and those will also be available on our webinars webpage so everyone can access them. And one question about what is the CERV-Net outcome evaluation measuring?
I can take this one. So the outcome evaluation is assessing whether CERV-Net prepared providers to improve cervical cancer prevention, screening, and management, whether it impacted cervical cancer prevention, screening, and management at the provider and system levels. And then we're also looking within that evaluation on whether it reduced provider isolation, because this was a unique opportunity to bring providers kind of across geography, across regions, to connect them. So we're curious if um, some of those connections lasted beyond CERV-Net and allowed providers to connect with others on similar challenges or barriers that they were experiencing. There was also a question asked in the chat about what practices are in place to recruit medical providers such as MDs, NPs, and PAs from diverse backgrounds in order to bridge the gaps in care and increase participation and buy-in from African American patients. The lack of Black providers has an impact on these initiatives. I definitely echo the sentiments, and thanks for the question. The HRSA Bureau of Health Workforce has programs in place to support the recruitment of providers from diverse backgrounds. So for example, BHW supports historically Black colleges and universities through programs like the Centers of Excellence program. This program funds resource and education centers at HBCUs to support health professions, education for underrepresented minority students and faculty. And that's just one of the programs BWH is also doing as additional programs to diversify the workforce, the health workforce.
Thanks, Ellen. And where can I learn more about the FCCC? We do have another webpage. It links to the resources webpage as well, but it has more information about the FCCC and the work that's been done in the past. And we'll be updating that with any future directions that we take as well.
There was one additional question I see in the chat about how, go to it here. How are we gaining trust within the African American community? Let me scroll up to read it out. What practices are in place to gain trust in the African American community? So we did a lot of stakeholder outreach within our 2022 and 2023 roundtable series, and we definitely heard how important it is to engage community partners. So within those sessions, our materials were informed by those with lived experience, including those with cervical cancer, those who had survived cervical cancer, providers, patient navigators, and community members as well. And we also, within our patient engagement toolkit, are encouraging health centers to connect with community partners. So faith-based organizations or community-led organizations. Those can include community partners that are influential within the African American community, but we agree that buy-in from all of our communities is really vital to ensure that we're reaching those underserved populations and reaching those who are most in need.
And I did see one other question about any efforts to engage other professions like mental health providers to do the education when patients are seeing them. I think we understand the importance of having people be able to talk outside of their silos and what their specialties may be. So having providers talk with one another and uh, making the information available to everyone who wants it. Ellen, do you have anything else to add to that? That may also be a good thing for a future FCCC project for how to bridge the gap with other providers to give them the information.
Yeah, we certainly know that uh, this isn't a silo. Mental health, behavioral health intersects with cervical cancer care. And so, yeah, I think we'll think as a collaborative how we can weave those in with our cohort 3. We've included a CEUs for social workers. So, that's an area where we can uh, connect mental health providers or mental health aspect into the education that we're providing.
I think we've captured all of the questions that I've seen come through. I have a few more slides to share that have our contact information and some ways that you can connect with HRSA. If you have any additional questions, please feel free to still include them in the Q&A. On this slide, you have Ellen's contact information. Give just a second for everyone to see that. And this next slide has my contact information. As a reminder, if you want any information about CERV-Net Cohort 3, please email me. And as soon as we have more information to share about the application process, I will be forwarding that along to you. And this is our final slide. HRSA is on 5 social media platforms. We encourage you to follow along and share our content on Facebook, X, Instagram, LinkedIn, and YouTube to stay up to date on the latest HRSA news. Our account/handle on each platform is @HRSA.gov. Additionally, we also encourage you to sign up for HRSA's e-news, a biweekly email of comprehensive HRSA news, and to sign up for HRSA press releases. You can also visit our website, hrsa.gov, for more detailed information about all of our programs. And we also have an Office of Women's Health, OWH updates newsletter. And if you're signing up for HRSA e-news, we also encourage you to sign up for that newsletter as well. And we can put the link to hrsa.gov in the chat, and you can see there's a subscribe button at the bottom. And with that being said, thank you all so much for attending today's webinar. And we hope that you found all of the information useful to help celebrate during the Cervical Health Awareness Month this January. Thank you all very much and have a wonderful day.